Howdy, welcome back to my channel. Today I will be telling you my top surgery top tips. I made a video before this where it's a bit longer and it's more of me just rambling and kind of recounting my tales of when I had top surgery, but I do go a bit more in depth about the entire procedure. If you'd like to watch it, it'll be linked in the description below. Before we actually get started, I'd like to point out I am not a medical professional. What I'm giving is just general advice for what worked for me, but you should always consult your doctor about stuff like this because they actually went to medical school, not I. So just keep that in mind with these, and if you have any questions, please let me know or reach out to your surgeon. The very first tip I have is to do research. You're going to want to research a lot of things about your surgery, about who's doing it, what procedures you're going to be having done, and what exactly you're looking for. Also, I would ask plenty of questions for your surgeon. Even if you think it might be a dumb question, you should still ask it so you get the full story of what's going to go on. It's your body and you should know fully what's going to happen. This can include such as if you can keep your nipples or if you want them off, nipple size, healing time, rules that your surgeon's going to have, do's and don'ts, and all that. My next tip is to keep in contact with your surgeon. I would say see if you can get any contact information for them where you can easily access them just in case you had any concerns. I know I had some concerns when I saw a little bit of pus along my incision line. He took care of me, made sure I was good. It was not infected luckily, but it was a big scare, and I want to make sure that you have medical attention if you need it, because an infection can spread very quickly and make you very sick very fast. My next tip is to have a good support network, whether it's friends, family, a partner, multiple partners, whichever you prefer. I think having someone around you physically will be great to help you do things that you may necessarily not be able to do for yourself, such as cooking, cleaning, maybe reaching stuff high off a shelf, getting you to doctor's appointments, helping you with taking your meds and stripping tubes, all that kinds of jazz. I would also say that because this is a procedure that's taxing on your body, it can also be taxing mentally, and just having a good support network of people you can talk to will really help. It's really okay to be emotionally fragile afterwards. I found that I was very emotionally fragile afterwards and almost a bit depressed, but talking with my friends, family, and my partner really did help with that. My next tip is don't smoke or vape before, during, or after your procedure. Particularly, nicotine is really bad for your healing. So ideally, 3 months prior to your surgery, if you're consuming nicotine, you're going to want to stop. And during the entire procedure of healing, you're not going to want to smoke because it'll constrict your blood vessels and can cause you to heal slower or make your scarring worse. I would just recommend that if you're quitting up to that point, to just stay off cigarettes or nicotine whatsoever, because you're still healing for months after the actual procedure. My next tip is pillows, pillows, pillows. Pillows are going to be one of your best friends during this entire procedure. You can use them for a multitude of things. You could use them to put them on the couch to help you get off the couch easier, since it's going to be hard to move sometimes. Putting them up on the bed will help you stay elevated and keep you nice and comfortable. I would also recommend using pillows when you're driving so that you could lay them between the seatbelt and yourself so that's not pressing directly on your freshly cut chest. My next tip is to eat well and stay hydrated. This entire time that you're going to be healing, your body's rebuilding itself, and it's very taxing for your body nutrient and water wise. So you're going to want to make sure you're eating really healthy food and making sure to stay hydrated, especially so you don't end up getting constipated, because that's no fun after the surgery. But eating well will help you so that your body can regenerate the tissue and close up those scar tissue. I know that I personally drank a vitamin drink called Huvin, I think it's called. I'll show a picture of it here. If you want to look into that, consult your doctor before getting some, but I found that that helped a lot too. For my next tip, I would definitely say take the stool softeners as soon as you can. Surgery is going to make you super bloated, you're going to be constipated from the pain medication, and it's not fun to be healing and constipated. So hydration and taking the stool softeners will definitely help with that discomfort. And before anybody asks, because I've gotten this question before, No, I did not need help wiping after my surgery. My next tip is to wear appropriate clothing. I'm not like shaming anybody for their style and whatnot. What I'm saying is you're going to want to wear shirts that button up or zip. That way you're not having to raise your arms, because that can make your chest not heal as well and can stretch your scars. For about the first couple of months, you're not going to want to raise your arms at all. So button-ups are going to be your friend. I'm also going to link in the description below a mastectomy hoodie that holds tubes that my partner bought for me, and the binder that my surgeon recommended to me. Quick side note about the compression vest: some surgeons will give you a compression vest of sorts, but this one that my surgeon recommends is good because it clasps up here, so again, you won't need to raise your arms. And also, I think overall it's a good idea to have at least 2 compression vests, because you're going to be in them 24/7 and they will get gross, I guarantee you. Speaking of getting gross, my next tip is figure out ways to keep clean, or at least feel clean. For the first week after my surgery, I was not able to shower, so this meant wet wipes, dry shampoo, or even having my friend wash my head in the sink while I just bent over, and an unfortunate incident with a bathtub. If you'd like to hear about that, you can watch my previous video. If you're really desperate to get your hair washed, I also know that some people will go to a salon specifically just to pay to get their hair washed, because they have that chair that reclines all the way, so you won't have to use your upper body to get up and out of a chair. Now, I keep talking about this, but my next tip involves the very affectionate name of T-Rex arms. Make your space T-Rex arm friendly. For about the first month or so, you're only going to want to raise your arms about this high. Any higher and you could end up maybe ripping a stitch, it'll make your scars worse, and also just not going to feel great overall. You want to make sure your chest has plenty of time to heal and merge back with itself, so make sure to put anything you're going to be using like very often at a lower space. This includes food, medication, toilet paper, clothes, anything of the sort. This tip also includes not lifting very heavy things, because again, you don't want to activate your chest muscles or else things could not heal properly. My next tip is movement is your friend. Even though you don't want to get your heart rate racing, walking around for as much as you can endure is a really good idea, just because it'll get your blood flowing and it'll allow you to heal better, and I think you'll feel better overall. When you're further along in your healing process, I would also recommend starting to do shoulder stretches. Because of how long I had my arms so low, I actually did lose a bit of shoulder mobility and had to do more stretching than usual. My next tip is don't freak out about your nipples. Nipples are really weird when it comes to top surgery. If you're getting rid of them, that's cool, this tip isn't for you. But for those who are keeping their nipples and getting them resized in any way, when you first get top surgery, you can't see your nipples at all because there's bandages on them. And then afterwards, when you can see them, they're basically going to look like scabs, and you're afraid they're going to fall off. Mine didn't fall off, but when the scabs did come off, I didn't have any pigmentation on them. They were pink. They were not brown like they normally were. You just want to make sure to keep in contact with your surgeon about any concerns you have, and make sure to be very gentle with your nipples. You don't want to scrub them when you're washing them. Just let water run over them, because they're still very fragile and need to reattach to your chest. My next tip is not to expose your scar tissue to the sun for at least a year minimum, because exposing it to sunlight can actually make you scar worse or darken them and make them hyperpigment. So if you're looking to make them very light, I'd recommend at least waiting a year before you go around shirtless. I know it might be difficult because you're super excited about showing off your new chest, but just weigh the pros and cons. My next tip is for scar care. For me personally, I use silicone strips basically the entirety of 6 months after my surgery. I would just place silicone strips over my incisions and keep them on all day. The only time they would come off is when I would shower, and when I would shower, I would take soapy hands and massage my scars in a circular motion, and the nipples, so you're breaking down that scar tissue so it's not as tight, and also so your scars will lay flatter and be softer overall. I do know some people use lotion on them, or vitamin, I believe it's K, or vitamin E oil, that's what my friend was using. And that's also a good option. Just keep in mind, if you're using silicone strips, it won't stick to your skin if you have anything like lotion or additives onto you. My last overall tip is to be patient and be kind with yourself. This is a major procedure where they're removing pounds of flesh from you, and it's okay to be emotionally fragile, like I was saying earlier. I actually felt very guilty that I was in such a privileged position to be able to have top surgery, and I wasn't all the way happy with it just because while I was healing, I just felt really bad and gross. But you have to realize that it's okay to not be okay. It's going to take time to heal, so the best thing you could do is be kind and be patient with yourself. Your healing process is probably going to take a lot longer than you think. You just need to be able to give yourself that time. So, those were 15 tips I had for top surgery. I hope that you found this video informative, entertaining. I hope that if you do have top surgery in the future, it's everything you wanted it to be and more. And thank you for watching.